Welcome to The Explainer. Today, we're going to crack open the medicine cabinet to understand one of the most common prescriptions on the entire planet, blood pressure medication. We're going to get right into how these drugs actually work inside your body.
All right, here's the game plan. First, we'll cover the absolute basics. Then, we'll see how your body actually controls its own pressure. And after that, we'll dive into the ABCs and Ds of these drugs to see how each type cleverly messes with those natural systems.
And this is really the heart of the matter, isn't it? See, high blood pressure can cause some serious, devastating damage to your heart, your brain, and your kidneys over many, many years, all while you're feeling totally fine. And that's why understanding how the treatment works is so incredibly important.
Okay, so let's kick things off with a super simple but really powerful way to think about what blood pressure even is.
I want you to just picture a simple garden hose. The pressure of the water inside comes down to two things, right? How much you crank open the spigot, that's your blood volume, and how narrow the hose is, that's the resistance. Crank up the water or stick your thumb over the end. Either way, the pressure shoots up. It's the exact same idea in your arteries. And this equation right here, this is the key to absolutely everything we're about to talk about. Here's the kicker. Every single blood pressure drug on the market works by pulling one of these two levers. That's it. They either reduce the amount of blood your heart is pumping, or they relax your blood vessels to lower the resistance. So, how does the body handle all this on its own? Well, before we can really get how the drugs work, we got to appreciate the body's own pretty sophisticated control systems. Your body basically has two pressure cops on patrol, and they work on totally different schedules. First, you've got the sympathetic nervous system. Think of it like a SWAT team. It responds in seconds to stress, it cranks up your heart rate and squeezes your arteries. Then you have the ROS. This system is more like a long-term logistics manager, slowly tweaking the fluid volume in your body over hours or even days. Okay, so this is where it gets really cool. We can see how these drugs are designed to cleverly hack these natural systems. We're going to start with the drugs that target that slow and steady RAAS system. We'll just call them the A drugs. So this is like a hormonal domino effect. It all starts when your kidneys sense low pressure and release a hormone called renin. That kicks off a chain reaction that ends at the creation of angiotensin II. And this stuff is potent. It squeezes blood vessels hard and tells your body to hang on to salt and water, both of which jack up your blood pressure. Now, there are two major classes of drugs that jump in and stop this cascade, and believe me, they are some of the most widely prescribed medications on the entire planet. First up are the ACE inhibitors. You can always spot them by their pril suffix. Think of these guys as saboteurs. They break that domino chain at step 3 by blocking the ACE enzyme. No ACE means no angiotensin II, which means less squeezing and less salt. Now, the only catch is, when you block that enzyme, another substance, bradykinin, can build up. And for some folks, that leads to this really annoying dry cough that just won't quit. Then you have the ARBs, which usually end in sartan. They take a totally different tactic. They're more like bodyguards. They let the body make angiotensin II, no problem, but then they stand right in front of its receptors and say, nope, you're not on the list. The result is the same, lower blood pressure, but because they don't mess with that ACE enzyme, that dry cough is way less common. So that's Team A. Now let's meet the rest of the starting lineup, B, C, and D. These drugs go after that other system we talked about, the super fast sympathetic nervous system, the fight or flight response. And remember our big equation? Well, these guys are all about tackling that first part, cardiac output. Beta blockers with their OLOL suffix basically just tell the heart to chill out. They block the specific spots that adrenaline uses to rev up the heart when you're stressed. This brings down your heart rate and the force of each pump, which directly lowers that cardiac output. It's kind of like putting a pair of noise-canceling headphones on the heart. All right, next up, calcium channel blockers. So if beta blockers hit the cardiac output side of our equation, CCBs go after the other half, systemic vascular resistance. They work by directly relaxing the blood vessels themselves. See, the smooth muscle cells that line your arteries, they need calcium to be able to squeeze tight. So, calcium channel blockers, which you can often spot by the I-pine at the end, do exactly what their name says. They block the little doorways that let calcium in. No calcium, no contraction. The arteries just relax and open up, giving the blood way more room to flow, which brings down resistance. It's like switching to a much wider garden hose. And finally, we've got the D drugs, diuretics. Now, these are the oldest players in the game, and they bring us full circle back to the cardiac output part of the equation. But they do it by reducing your total blood volume. Diuretics, or water pills, as you've probably heard them called, are beautifully simple. They just signal your kidneys to get rid of more salt, and water follows salt right out of your body through urination. It's simple, right? Less fluid in the system means there's less total volume for your heart to have to push around. And just like our hose analogy, less volume means lower pressure. So with this whole alphabet of options, A, B, C, and D, how on earth does a doctor choose the right one? Well, it's definitely not like throwing a dart at a board. It's a strategic move, often to solve a couple of problems with just one pill. This is what doctors call a compelling indication. They're looking for a 2-for-1 deal. For example, if you have diabetes, an ACE inhibitor doesn't just lower your blood pressure, it also gives your kidneys an extra layer of protection. Or if you've had a heart attack, a beta blocker is a no-brainer to protect the heart muscle. It's all about matching the drug to the person's whole health picture. Okay, we have gone through a lot of pretty complex stuff here, but I promise you, the single most important message from decades of research is incredibly, beautifully simple. This is the number you need to remember. Seriously, burn this into your brain. A massive analysis of tons of studies showed that for every 10-point drop you can get in your systolic blood pressure, your risk of having a heart attack, a stroke, or even dying just plummets. So here's the bottom line, the most important thing to take away from all of this. While all this chemistry is fascinating, what actually saves your life isn't whether your pill ends in Pril or Olo. It's about finding a medication or a combination of them that gets the job done for you and successfully and consistently lowers your blood pressure. The best drug is simply the one that works. So now you know how these drugs work. And this isn't just trivia, this is power. It empowers you to go and have a really good, informed chat with your doctor to make sure your treatment is the absolute best it can be for your health. That's it for this explainer. Thanks for watching.